Okay.
Hello, my name is Josh Lutchman. I'm a second year medical student and I've been asked to do a respiratory examination today. Is that okay with you?
Yes.
Lovely. Could I just confirm your name and date of birth, please?
Darren Prabhakar, 15th of July, 1998.
And that makes you how old then?
24.
Lovely. So Darren, I've been asked to do the respiratory exam. Have you ever had one before?
No.
Would you like me to just explain it for you?
Yes, please.
Lovely. So I'll be having you on the bed. We're going to be starting with your hands and then your arms. I'll then move into your face and your neck. I'll then ask you to expose your shirt, just so I can get to your chest and have a look for anything. And then I'll be having a listen and be tapping on it. Do you have any issues with that?
No.
Lovely. And do you need a chaperone for this examination?
No, I should be fine, thank you.
That's fine. And are you in any pain at the moment?
Not at the moment.
That's fine then. So if I could just ask you to be on the bed, don't worry about taking your shirt off now, and then I'll get my equipment ready and we can get going. Okay, Dylan, I'm going to start the examination now, if that's okay with you. Lovely. So I'm going to be speaking through the examination as well. All good?
Yeah.
Lovely. So I'm just looking for any obvious discomfort and pain, which you seem to be okay, not in any pain at the moment. Lovely. Just looking at the colour of the skin and the patient, which seems to be normal. The patient seems to be breathing comfortably and there's no audible wheeze or stridor. I would also do respiration rate at this point, but we're going to come back to that later. And I'm just looking for any items of note around the bed, which I don't seem to see. I'm also going to have a quick look at the patient's skin, which I don't seem to see any erythema nodosum, but I'll come back to that as well later. Okay, Dylan. I'm going to be starting with your hand, if that's okay. If you could put them out like this for me. I'm just going to have a quick general observation to begin with. Lovely, and if you could turn them over for me as well. Just looking for any scarring, any redness or swelling at this point. So if you can turn it over again. I'm just going to be starting by looking for clubbing. So if you could put your fingers like this for me. Lovely, and I'm just looking for the diamond, which seems to be there. That's all good. If you could put your hands out like this for me. I'm just going to be starting by looking for any tar staining between the fingers, which doesn't seem to be present. Perfect. If you could turn your hands over for me. I'm looking for peripheral cyanosis, which would be any bluing, which doesn't seem to be present as well. I'm now going to be looking for tremors. Could you put your hands out like this for me? We're looking for tremors, which could be signs of salbutamol use, which doesn't seem to be present. And if you could move your hands like this for me now. And we're looking at carbon retention at this point in COPD, which doesn't seem to be present as well. Thank you very much. You can put your hands down. I'm now going to move on to doing a blood pressure at this point. Okay, Dylan, I'm going to be moving on to your face now, if that's okay. So, if I could ask you to pull your eyelids down and look up for me. Lovely. At this point, I'm looking for any conjunctiva, which would be indicative of anemia. Thank you so much. You can let go of that. Perfect. And if you could open your mouth and stick your tongue to the roof. Lovely. And open your mouth as wide as you can. Thank you. I'm looking for central cyanosis, which would be any bluing, which I don't see at this point. Thank you so much. So Dylan, I'm just going to be looking for a vein in your neck, if that's okay. So if I could ask you to look left and up at the ceiling for me. That's fine. I don't see a raised JVP at this point. Have you got any stomach pain at the moment, Dylan?
No, I don't.
I'm going to be pushing on your stomach just to elicit a hepatojugular reflex. Is that okay with you?
Yes, it's
That's fine. So if I could just get to your stomach just to push through. Lovely. Just going to be pushing. And there is no raised JVP at this point. That's fine. You can relax now, Darren. Okay, Dylan, we've now reached the chest, so I'm going to need you to expose this point. So if I could ask you just to remove your shirt, and then I'll be right back. Okay. Okay, Dylan, thank you for taking your shirt off. So I'm going to be starting with a quick inspection of your chest at this point. I'm looking for any scarring, any deformities. I noticed you have a scar here. What was that from, if you don't mind me asking?
It was from previous laparoscopy.
That's fine. And there doesn't seem to be any other deformities or asymmetry at this point. Okay, Dylan, I'm going to be feeling on your chest now, if that's okay. So I'm going to be starting with your trachea, okay? So it may be feel just a bit uncomfortable, okay? So we're just looking for any deviations of it, which doesn't seem to be present. That's fine. Now I'm going to move on to chest expansion. So I'm just going to be wrapping my arms. I just want you to breathe in and out as deeply as you can, okay? Right. So I'm just going to come round and take a deep breath in and out. Lovely. So that moved more than 5 centimeters, so that's all normal. We're going to move on to the next part now. Okay, Dylan, I'm now going to be tapping on your chest, if that's okay. Okay. Just comparing both sides at this point. Both sides are fine. Thank you so much. Okay, Dylan. I'm now going to be having a listen to your chest, if that's okay with you. So, every time you feel the stethoscope on your chest, can you take a nice deep breath in and then back out for me, okay?
Mhm.
Lovely. Deep breath in and out. Okay. Nice deep breath in. And once more. Lovely. Now, every time you feel the stethoscope, can you say 111 for me? Yep.
1, 1, 1.
Lovely.
1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1.
Perfect. Thank you so much. If I could ask you just to swing your legs around the bed, just so your back's facing me, and I'm just going to be listening to your back now. Okay. Perfect. You can just do that for me. Okay, Dylan, it's going to be starting with a quick inspection of your back. So I'm just looking for any scarring, as I said before, any deformities, and any asymmetry, which I don't seem to see. Okay, Dylan, I'm now going to be feeling again, but we're going to do chest expansions. Just need you to take a nice deep breath in and back out again, okay? Right, I'm just going to put this around, and nice deep breath in, and back out. Lovely. I'm going to be tapping on your back, if that's okay with you.
Yeah.
Lovely. Perfect. I'm now going to have a listen, okay? So every time you feel the stethoscope, can you just take a nice deep breath in and out for me, okay?
Mhm.
Deep breath in. And out. In. And out. In. And out. Lovely. And now every time you feel the stethoscope, can you say 111 for me?
1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1. 1, 1, 1.
Perfect. Thank you so much. Okay, Dylan, the last part is just looking at your lymph nodes. That means I'm going to have to feeling your chin, around your ears, your shoulders, and your neck. Is that all okay?
Yeah, that's okay.
Lovely. I'm going to be doing it from the behind, okay?
Mhm.
That's fine. So, looking at your submental, submandibular, preauricular, postauricular, just looking at the occipital, posterior cervical, anterior cervical, and your supraclavicular. And that's everything. If you could just lie back down on the bed for me. Okay, Dylan, that completes my examination for today. Thank you so much for your time. You can put your shirt back on, and you can come meet me outside. So today, I did a respiratory examination on Dylan, a 24-year-old male. On general inspection, everything was normal, and there was no signs of wheezing or stridor, and the patient was comfortable and not in pain. There was no peripheral stigmata of respiratory disease, and on auscultation, palpation, and percussion, everything was normal. Overall, this is a normal respiratory examination. To complete the examination, I would do a peak flow reading, look at any sputum available, and also check his temperature. I can have your finger. You just rest